China is the most populous country in the world. 1 out of every 5 humans lives in China. The Bay Area is home to over 500,000 Chinese people. For the next 10 minutes, we will be discussing healthcare topics related to Chinese people and will include clips of 2 interviewed Chinese nationals.
To provide culturally competent care for Chinese American patients, it is important for providers to have background knowledge of the traditional health beliefs and behaviors in the Chinese culture and the historical experiences that may have influenced the current cohort of Chinese American elders. There are 4 major traditional religions and philosophies in China: Confucianism, Buddhism, Taoism, and ancestor worship. These belief systems have had major influences on Chinese character and behavior. In addition to these religions, many Chinese Americans practice Christianity.
The yin and yang are the general laws of opposing forces. Yin represents the female and negative energy and cold, while yang represents the male with positive energy and hot. Illness results from imbalance of these forces. Foods are classified as hot and cold, and a proper balance is required to maintain health. Illnesses and treatments are also classified as hot and cold. Taoism, known as the Way, places an emphasis on selflessness, cleanliness, emotional calm, and conformity. It emphasizes the mystical aspects of human nature. Other important teachings and beliefs include the concept of karma.
Chinese philosophy. Chinese people have no religion, you know that. Okay, the religion that you think of Chinese people being Buddhism and all that. Buddhism actually came from India, so it's not a Chinese religion. Chinese people really believe, you see them burning incense and all those things. It is a belief of their ancestors. They always have I call it a plaque. It's a thing that they put there for their ancestors. And they will go and have the incense to go and put there. They will put fruit in front of there to go and respect their ancestors.
The Chinese patient may avoid eye contact. Communication is often nonverbal and indirect as means of avoiding conflict and should not be perceived as indifference. The Chinese culture has been described as a high-context culture, one in which words alone do not convey the message. It relies on presumptions shared by people, nonverbal cues like body language, and the very situation in which the interaction occurs. In contrast, American communication is more direct, verbally expressive, and low context. Outward expression of emotions in sexual relationships, such as hugging, kissing, and holding hands in public, are uncommon. On meeting someone, the Chinese may nod or bow slightly and may shake hands. They may stand to greet an older person or offer a chair. A smile is acceptable.
The Chinese respect for authority may lead them to defer all health decisions to the professional. They may not ask questions. A response to yes or no questions may be a nod. This may not indicate understanding, just that the person has heard you. Asking the patient open-ended questions and/or repeating what you told them can affirm patient understanding.
In healthcare, treatment decisions may be made by the family unit. Family comes first before the individual. Caregivers should be sure to establish relationships with patients' family members and friends. Always address elders by Mr. and Mrs. and family name.
Pain is accepted as part of suffering and something to be endured. The Chinese patient may not actively complain about pain or express it behaviorally while actually experiencing pain. Providers should ask again about the level of pain and offer pain treatment again if initially refused. Education should include how to use a pain scale, the acceptability of receiving treatment for pain, and how enduring pain does not contribute to recovery.
Our whole physical being is powered by energy, and that energy is what we call qi. And qi runs through certain pathways in the body, and sometimes that pathway gets blocked, either because of physical blockage, let's say if you broke a bone, or it could be caused by bad lifestyle, eating too much salads and too much cold foods. That causes the slowdown of energy, which then causes a blockage. So when the energy doesn't flow and it gets blocked, it's like a traffic jam on the freeway. Things just aren't moving, and then you have congestion. And that congestion becomes noise and pain, which then affects, which causes pain, and which causes swelling. I mean, it's pretty easy to visualize. It's really like a bad traffic jam. And so how we treat that is with acupuncture or herbs.
Common medical problems among the Chinese are depression, alcoholism, dementia, infectious diseases such as hepatitis B and tuberculosis, smoking, cardiovascular disease, diabetes, and cancer of the liver, nasopharynx, breast, prostate, colon, and lung.
Along with the principle of yin and yang, a holistic philosophy of maintaining balance in life, the Chinese patient may consider food as having hot yang or cold yin properties. This has no relationship to the actual temperature of the food. They may prefer hot food to cold food, like salad when having a cold yin illness. Rice is the most important food and may be eaten at every meal. Pork is the preferred meat. The patient may not be aware that sodium is in many Chinese sauces and condiments. Other sources of sodium may be in salted fish or preserved meats and salted vegetables. Milk, butter, and cheese are not generally used due to lactose intolerance.
My upbringing is that we always have soup every day. We have some sort of a soup. So you take the soup first, have a bowl of soup, warm your tummy, whatever, and then you use the same soup bowl, and then you put rice in there, and then you have the different dishes. A veggie dish, meat dish, either pork or beef. That's what I do now. Maybe a seafood dish, and maybe 3 dishes. I think the milk industry in this country did a lot of people a disservice, because not everybody can drink milk, and so milk is not good for everyone.
It's going to slow down your system. It's going to cause energetic blockages. And so it would not be appropriate for someone, mostly like young women who are kind of thin, and they're eating a lot of salads. It's going to cause trouble in the long run.
At the root of traditional Chinese medicine is the belief that the individual is viewed as an integral part of the forces of nature. In herbology, ginger root is often used in traditional Chinese medicine to treat symptoms of indigestion, the common cold, and other ailments. Additional measures are taken such as acupuncture and acupressure. Another method is cupping, where you use heated bamboo cups to reduce stress, congestion, and colds. In the yin and yang concept, elders may avoid the cold and may avoid certain foods considered to be cold foods. Meditation and exercise are other methods to help alleviate stress.
Chinese medicine is a holistic medicine where we take into account the emotional, the mental, and as well as the physical state. So each one affects the other. So if you have some severe emotional or mental disturbances, it's going to affect your physical well-being, as well as if you have some physical problems, it's going to affect your mental and emotional as well. So when we treat in Chinese medicine, we look at the whole person rather than in parts.
Some of the herbal teas, some of the teas are for instance, when you have a cold, you drink certain tea. When you have a sore or something like that, or what do you call that in your mouth, a canker sore or something, then you get a different type of tea.
It's important to consider that some Chinese may be fearful of hospitals, surgery, and needles. Western medicine may be used only when traditional remedies have failed. Blood tests may be avoided as they allow the qi, the essence of one's body energy, to leak out. Patients may believe symptoms should be relieved promptly by medication, and that an illness is cured if its symptoms go away. The concept of health maintenance may not be appreciated. It is important to ask what other Chinese herbal medicines the patient is using to avoid drug interactions and adverse reactions. Patients may require education on drug and herb interactions. Mental illness is not recognized. The Chinese fear stigma from their community. Gong Hai Fat Choi.